Thank you for showing up. I know you all must be as passionate as I am about mental health for children. So I do have a lot of slides and I want to make sure that we have time for questions. So I'm just going to go ahead and get started. So just my disclosure statement, no personal, professional, financial conflicts of interest, no FDA or investigative medical devices on this talk. Do want to just mention again, I do work as an unpaid director for Reach Out and Read Iowa and Sesame Street and Communities, and then on the AAP. So I work both with our chapter in Iowa as well as the national chapter or the national AAP on initiatives. So all right, so here is what I would love you to know by the end of this talk. I want to increase your awareness of statistics regarding a child and teen mental health emergency, and then describe the AAP mental health competencies. I'm going to show you the aap.org mental health website and walk you through some of the key places to find information there. We're going to walk through the algorithm that has been designed by AAP experts for addressing mental health care and primary care, and identify some mental health tools that you can use in your practice, in partnerships, in training, or in policy. And then I hope that you select at least 2 mental health resources you can plan on accessing in the future. So make that your goal. You're going to find 2 things you find interesting during this talk. So this talk isn't to teach you something very specific about mental health. This topic is very much like a super sexy talk from a librarian. So here's a picture of a super sexy library, and it happens to be Justin Trudeau, but I put a picture of my husband on it. So he's a librarian at Drake. So he's really good at finding information for you. So this talk is designed to help you find the information you need to take care of children and families. So statistics, you already know, you've probably heard it all day today, how the state of America and the state of mental health for children in America. 14 million children have a diagnosable mental health disorder. Over 20% of U.S. children and adolescents experience a mental health concern each year. And during COVID, those numbers can be reported as high as 28%. Suicide is now the second leading cause of death in ages 10 to 24. And when you report a mental health condition as a child, you are 6 times more likely as an adult to have poor life or health outcomes. So it's important to be able to identify these and to be able to do something to mitigate these, to prevent those problems in adulthood. Here are some recent statistics of how COVID has affected children's. So 2 out of 3 children reported difficulty completing schoolwork in adolescence. 1 out of every 4 experienced hunger. 1 out of every 4 experienced parental job loss, and 1 out of every 10 experienced physical abuse by a parent. This was a very stressful time for our children and teens, as you know. 1 out of every 3 students had poor mental health during the pandemic. 1 out of every 3. Oh my goodness. 2 out of every 5 students felt emotional distress during the COVID years, and 1 out of 10 attempted suicide. So as you know, one of the mitigating factors to poor mental health is feeling close to other people. And that's certainly not how any of us felt during COVID. So we went through a lot in 2020, and in 2021, things got a little worse for our teens as they began to really feel the effects of being isolated. So in October of 2021, the AAP, in collaboration with the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association, declared a national state of emergency for children's mental health in the United States. And to summarize their declaration, what they said was the COVID-19 pandemic exacerbated the already increasing rates of mental health challenges among children and adolescents in the U.S. And the inequities that result from structural racism contributed to disproportionate impacts on children from communities of color. So there was a call to action. We must identify strategies to meet these challenges through innovation and action, using state, local, and national approaches to improve the access and quality of care across the continuum of mental health promotion, prevention, and treatment. So what strategies did they come up with? Well, they hope to increase federal funding for screening, diagnosis, and treatment of mental health concerns, improve telehealth increase implementation of school-based mental health access, accelerated adoption of integrated mental health care and primary care, strengthen prevention efforts to reduce the risk of suicide, address the ongoing challenges of the acute mental health care needs of children, fund systems of care that connect families with community behavioral health interventions, promote and pay for trauma-informed care services that support relational health and family resilience, address mental health workforce challenges, and advance mental health parity policies. So that was in October of 2021. How are we doing so far with all of those? I feel like we have seen some telehealth initiatives out there, and there's been some discussion at the state about mental health workforce, and there's been actually some forward movement with mental health parity. So we've seen some, but overall, as a primary care provider, I have not felt a lot of those effects with my ability to take care of children. So that's where I'm at right now. I don't know if you feel like this picture, but that's kind of how it felt. Like there's just a breaking point. So what about right now? What can the AAP do to help us right now with the kids that come into our clinic who are not okay? So this has been a project for the AAP for specifically the AAP Task Force on Mental Health from 2004 to 2010. And they've developed some of the resources that you will see coming up. And then the AAP Mental Health Leadership Work Group is still working on resources. And last night I was on an AAP leadership conference call where it was announced that they're designing an entirely new mental health center that we can access as pediatric providers to have more resources. So there's nothing written or online about that. That was just word of mouth, but I was told that I could announce that today. So stay tuned for more resources, actually. So we're going to walk through the website. When you think about why you should use the website, what is it good for? It's best to come with some specific questions about how can I educate my fellow providers or my partners in practice? How can I educate my patients and family? What if I teach students or residents? What about my chapter and chapter members? And then what can I do to work on my practice improvement or quality improvement? And then what about community partnerships? Is that something that I can find resources for on the website? So here's a thought, what if you're the head of your chapter's mental health committee? What if you want to educate and support your members with some mental health resources? Are there resources for you? What if you're thinking about your patients? I'm struggling to meet the mental health needs of my patients. What should I do? Or what if you work in med ed? I want to teach future pediatricians about mental health. What should I use? So those are some examples of questions that you should have in your head when you're headed towards the website. So let's get ready to navigate. We're going to follow the yellow brick road over to the AAP. And of course, we'll see the wizard. We'll see Mark Del Monte, the CEO, and he's actually holding Doc McFinchy, which is Iowa's AAP mascot. So here is the website. When you go straight to aap.org, you don't have to be a member of the AAP to go to aap.org. So all of the resources, -1 at the end, are resources that you can access without having a membership to the AAP. So this is the home page, the landing page. And then you can go, so there's the website, www.aap.org. And then if you see at the top, there's a button way at the top on the left-hand side called Patient Care, and you would click that. And then up would pop this long list of different different topics, and you can find mental health initiatives. Luckily, they're arranged alphabetically, like a good library should be. And you can click that. Or if you forget how to do any of that, you can go to search all AAP and type in mental health, and that will help you out. So once you've pushed that mental health initiatives button, up pops this page here, and it talks about how mental health is, of course, an essential component of overall health. We already knew that. So if you scroll down on this page, this is what you find. And so these areas are what we're going to address today. And I'm going to start with the AAP policies. So in very small print here, you can see mental health competencies here, and then how to achieve those mental health competencies, and then additional policies. So let's take a look. This is one of those additional policies, but so important for us to have reviewed. It's the Guidelines for Adolescent Depression in Primary Care, or GLAD-PC. It's just really good for all of us to have heard of GLAD-PC, because people talk about it, and if you're like, I don't know what that is, you probably should. So this is part 1, and then we're going to look at part 2. What are the guidelines? What are the clinical practice guidelines for treating adolescents with depression? This is practice preparation, identification, assessment, and initial management. That's part 1. And this is the summary. So if you don't feel like reading the whole thing, you can just look at the summary of recommendations. So primary care providers should seek more training in depression assessment, identification, diagnosis, and treatment. We should establish relevant referral and collaborations and consultations with mental health experts and resources. Adolescents 12 and older should be screened annually for depression. And patients with depression risk factors should be identified, monitored, and screened. I love this monitored. I'm very interested in that part. And they even suggest having a tracking system. We should evaluate for depression in those who screen positive on, and we should use the formal screening tools that are out there. And I will help you find the screening tools, but think you can use the DSM-5 as one example of a formal screening diagnostic tool. And then PCP should educate and counsel families about depression and options for management, and develop a treatment plan, and make sure you have a safety plan and emergency plan. So you can kind of assess how you're doing with those recommendations. And then this is the part 2 of GLAD-PC. So what should we do for treatment and ongoing management? So you should include an integrated behavioral health model in your primary care practice. Easier said than done. For mild depression, consider a period of active support and monitoring. So that means check in every couple weeks with your very mildly depressed teen and say, how's it going? How's it going? How's it going? Before you decide to do any other treatments. For moderate or severe, consider a consultation with a mental health specialist. And you should recommend scientifically tested and proven treatments. And you should monitor for adverse effects of treatments. And you should regularly track goals and outcomes. How are you doing? And how are you functioning in all of your settings? You should reassess diagnosis and treatment if they come back in 2 months and nothing has changed, or maybe they got worse. You should consult a mental health specialist if only partially improved after you've thrown everything at them and it's not getting any better. And then you should actively support depressed adolescents who have been referred to a mental health specialist, but either can't get in, or there's a wait list, or they've been in, but they're not going back for a while. So make sure that you're kind of the safety net for them if they need it before, during, and after their consultation with mental health experts. All right, so in addition, there is this policy that you should also be familiar with, which has been updated in 2019, called mental health competencies for pediatric practice. Now, if you recall all the way back to medical training, there's our ACGME that has required us to have 6 competencies, or if you go to a DO school, 7 competencies to be able to graduate. So we want you to have a handle of all of these things. So the first is patient care or clinical skills. So when we focus in on the mental health competencies, that's one that really that they want you to get better at, is your patient care skills. So that includes primary prevention, secondary prevention, assessment, and treatment. And then they want you very much to get better at practice-based learning and improvement. Those were the 2 competencies that were covered in this mental health competency policy statement. And I don't want you to read this, but I want to show you that it exists on the website. So when you get down to brass tacks about how can I focus on my core pediatric mental health competencies, what do you want me to really look at? This is a 2-pager that goes over that. So now that you know that this resource exists on the website, you can say to yourself, aha, this could be an idea for my chapter or my colleagues to sit and review the guidelines for adolescent depression in primary care, those GLAD-PC guidelines that everyone should know, or maybe review mental health competencies for pediatric practice. How are we doing? Are we hitting those? Or review these with medical students. Okay, so another topic. What if I don't feel comfortable with my own management skills for my patients who have depression, anxiety, other mental health concerns, or are yet undiagnosed but have some concerns? How can I get more training for myself? So back to this website, this landing at the mental health initiatives page. We've already looked above at those policies, and now we're looking at physician education and training. So I'm going to click that button for you so you don't have to. And here is what we see. So there are a series of videos for resources for you, including some that I'm going to highlight. As you can see, it would be a very long talk if I clicked on every button for you and highlighted everything. So I've picked a few for you to know, but I do want you to know that there is much more available than what we'll cover today in this talk. The point is that you know where these things are and why they might be useful. So let's take a look at this Pediatric Mental Health Minute series. So I clicked on this. I'm not showing you a video here. I'm just saying, hey, this is not actually a minute. It's 14 minutes. So if you have 14 minutes and you'd like to review what experts tell you about helping adolescents feel in control during stressful times, I think that would be very, very useful. So you could definitely do that. And they have, of course, other pediatric mental health minutes. Another one were those other EQUIP or PediaLink teaching tools. If you are an AAP member, these are free online, but if you are not, you have to pay for them. So just so you know, here are some examples of an EQUIP. So it will give you MOC and will help you with relational health and fostering resilience. And then this PediaLink course will help you with childhood adversities and trauma. There are many more examples online. Then there's Project Echo, and Project Echo is a collaborative, and these are actually live interactive group meetings. So this is something that you would have to know about in advance. The Project Echo that has to do with mental health is ending at the end of June, but just always know that you can keep your eyes out if you receive any emails from the AAP, or just visit the AAP Mental Health Initiatives website to keep up to date about opportunities. So Project Echo is where you have kind of a back and forth conversation. We have the AAP mental health experts talking to others in the community, and you can be one of those others in the community, and you listen, and then you give feedback, and everybody's learning from one another about specific mental health concerns. So it's a great opportunity to learn and have a voice. Okay, so what about if your practice needs to have more screening tools? What if you feel like you're not great at screening for certain things and you wish you knew where all the screening tools were and what they were all about? So is there a resource for that? There is. So now we're going to move from the physician training over to practice tools. All right, so as you can see, there are a ton, and we can't possibly look at all of them, although I did for you. I did the research for you. So keep in mind that they're sectioned out between readying your practice and then getting a good workflow for your practice, and then brief interventions during that workflow. And then, so we're going to look at 1, 2, 3, 4, 5, 6, 7 of them. This is page 2, and there are effective referrals and more additional AAP resources. And I had to highlight the STAR Center because I think that's one of the most useful sites on the AAP for finding screening tools. And then external resources that the AAP trusts as well. So number one resource is this readiness inventory. So if you were going to make any practice changes, if you have ever made any practice changes, you better know what is needed. And so this is actually a multiple page survey or inventory of your practice of how ready you are to implement any mental health practice changes. And I just summarized it on the left here so you can see what the survey is about. It looks for how are you doing with your core services or collaborative relationships, healthcare relation with finances, how are you doing with payments or coding or billing, and then finally support. Do you have great practices for first contact, culturally effective care, mental health promotion, etc. So this is a great way for you to assess how ready your clinic is, where the areas of need or gaps in care are. And this is the algorithm. And we're going to spend a little time looking at the algorithm because this helps you know what we're supposed to do when we have someone come in and say they have a mental health issue. So we can see how good we are at following the recommended algorithm. So this document, which is number 2 on my little chart of practice tools, is a 6-page document. We're not going to go over all 6 pages. This is kind of just a picture for you of what the whole algorithm looks like. It might look very busy to you, and you might say, hey, that looks familiar, kind of familiar. So reviewing this algorithm might be something that your practice needs to do, or you need to do individually, or maybe have someone discuss it during a chapter chat or something. But I'm going to break it down for you. So this is, how do you integrate mental health care into a busy pediatric workflow? Look, they know we only have 15 minutes to do these visits, so they try to make it simple. And what they want you to do is look at this algorithm sort of like acute fever in a young child without localizing signs and symptoms. So we're all pretty familiar with how to work up fevers. So this is how to work up mental health. So what you'll see is the problem is brought up, and if you look at number 1 and number 5, it either is brought up at a routine health visit, or number 5 is like it's brought up at an acute care visit. So either of those is possible. So then what happens is you're going to do some screening. And then what if your screening shows that everything is pretty much within the normal variation for age? Then you're going to provide reassurance and promote a healthy development and resilience. But what if it's abnormal? Then you're going to set up another visit for them to really get into more depth. So that's how the algorithm looks. So you have to know how to screen in order to complete that. So here are this number 3 on the practice tools is screening tools. And there's a whole long line in this really handy chart. And so the chart will tell you how many items are on the screen, what age group it's for, what languages it is, how long it takes to administer, and then how long it takes to score it. And then if it's free, which I love, and then they give you the link to it. So this is a great way to be able to access free online screening forms that are validated and who uses them. So I think this is a handy way of organizing screens for you guys and for me. And then, okay, this is kind of a brief health update. So how can you briefly update yourself with how your patient is doing? So they give this example of, hey, if you're 0 to 5, we're going to ask the following questions. How have things been going? How are you coping? So anyway, this is just an idea for how you can shape and tailor those follow-up visits to check in after you've started some treatments. Okay, so this is a great idea for you. Aha, now I know where some mental health screening tools are. So maybe my chapter could discuss different screening tools or take a look at them. All right, so next in the algorithm, after you have done the screening and you've identified an issue, your next question is this an emergency? Is this person in danger right now, or are they not? So if it's not, then you're going to do a brief you're going to engage them using common factors, and I put a little asterisk, we'll get to that. Then you're going to review the primary screening and consider secondary screening. And if you decide it's not emergent, you're going to do a brief therapeutic intervention and follow-up. And if it is emergent, you're going to employ efficient referral for emergency services. And so here I think I put, this is one of the suicide assessment screenings that you can do. It's called the ASQ, but they also are like, please don't confuse it with the other ASQ. So this is, again, on the screening forms that I pointed out on the last slide that you can find. So what are common factors? That was mentioned. You're supposed to employ common factors. I'm not here to teach you what all the common factors are, but I do want to make you aware that this in particular is worth a deep dive. And last year when I went to the National Conference and Exhibition for the AAP, I went to a workshop on common factors and found it extremely helpful. So this is a tool that you have to work on developing. It's not something that it's easy to just read about and be good at. And that's why workshop form is the best way to learn common factors. But it talks about how to engage with your patients and create that therapeutic alliance using the HELP format. So hope, empathy, language, and loyalty, and then permission, partnership, and plan. So it's very much similar to the motivational interviewing style of, is it okay if we do this together? Is it okay if I ask you these things? And again, a whole other lecture. Now, that this is now more specific. So that is for just how you engage with all of your families, especially if they have some mental health concerns. So now brief therapeutic interventions using common elements is very specific to different presenting problems. So it's a way for you to help families during your visit, help them manage some of the concerns that they have. So you can see in the presenting problem area, anxiety, ADHD, and low mood. And then you can see some of the common elements and related evidence-based practices that you can even discuss and model and do during your short visits. So this, again, worth a very deep dive, worth getting some more training on, because it really can make you feel more confident going into those conversations. Haha, exactly. That's what I said when I saw them. Haha, I think this is a great learning opportunity to figure out what brief therapeutic interventions look like, get good at them, figure out what common factors means and how can I practice those, and what about common elements and how can I use those as an intervention in my clinic. And then I had another aha during this. What if you wanted to use some of these as a quality improvement project? So as a pediatrician, I need to do my MOC4, which it says right down here, I have to figure out a way to change my practice in some way to improve it. And if you guys haven't discovered this already, you can make your own quality improvement project, and it is not that bad. I did it before, I got credit for it. So one thing you could do is just like figure out what your aim is. And if you really want to improve the way that your clinic handles mental health concerns, and really specifically get really specific about anxiety or ADHD or depression, you could start with a measurement tool like the readiness survey, or you could pull ideas from the readiness survey. And then you could do an intervention such as introduce one of those new screening tools from the resources, and then reevaluate using the readiness survey questions that you found. And then you could introduce another intervention. You could train them on brief therapeutic interventions, and then you reevaluate using those questions with the screening tool. And there you got it. Then you just show your data, write it up, and you've got your MOC4. So that's just another idea for you guys. So back to the algorithm. Okay, so you've done an assessment, but let's say you think this person needs a full diagnostic assessment. Who's going to do that? Is it going to be you as a primary care person? Is it going to be a mental health specialist? Could be either one. It just depends. And then you're going to create a family-centered care plan. And then you're going to implement the care plan and then continue to manage and monitor or co-manage if you have a mental health expert with you. And then check in and be like, hey, are you better? Yes or no? And if not, you go back to the beginning and complete the pathway again. So this might mean that you might need some more tools. So I really want you to know about the STAR Center if you don't already know. And the STAR Center is a great way to find just about any tool for just about any screening that you would want to do. So you can find screens for social determinants of health. You can screen for resilience and family strengths. You can screen for food insecurity. So just a long list of screening tools that you can find. So definitely take some time to visit the STAR Center. All right, so obviously treatment is part of this, and this is one of the external resources that the AAP has found that they trust from Johns Hopkins, so a guide to psychopharmacology. And there's also some great resources for ADHD. You know how sometimes you're not really sure if the ADHD medicine is a pill that you swallow, or can you open the pill and sprinkle it, or what does it look like? And then, so there's some great resources for those with visuals of the pills themselves. All right. So now, what about my families? I really want to just give my families some handouts. I want to help them more specifically and more directly. What family resources are there? So then we're going to move from practice tools over here to the resources for families tab. And there are lots of PDF handouts. I'm just going to show you the managing depression or sadness handout so you know. And it looks like this. So it's not long. It's only page 1 of 3. So you could copy this and paste it into your electronic medical record, or make a dot phrase for it. And then zoop, it can go straight to your family at the end of the visit. So that's definitely doable. And then there's also some tips for young children on here to promote social and emotional health. That's where I like to think that's my favorite area of focus for pediatrics is young kids. So how can we help families promote social and emotional health? A great idea for my practice, incorporate these mental health handouts into my electronic health record. So definitely think about how to do that. All right. So what if I wanted to work on community resources with other partners? Who could I partner with? Just a brief look at the National and Community Resources button here, because the AAP is not the only group working on mental health for children. So this is what I did a screenshot of so that you could see if you wanted to click on any of these later. So they have, child and adolescent psychiatry links. They have a link to the National Alliance on Mental Illness, and many, many more. So, now you might have heard in the introduction that I'm the Iowa CATCH facilitator. So CATCH, again, is Community Access to Child Health. So if you are a pediatrician and you wanted to get a grant of about $10,000 to help families access some of those community-based resources, you could partner with NAMI or another child mental health organization in your area, and you could call me, and then we would work on how you could improve access to care for kids. Oh my gosh, that's so overwhelming. It's all overwhelming. Oh my gosh, I feel overwhelmed. People left us behind during COVID. They forgot that pediatric providers are not okay. What can we do to support ourselves? So here is Physician Health and Wellness button. And at the last AAP leadership meeting, Physician Health and Wellness was made as one of the top resolutions passed at our leadership forum. So it is a big AAP priority to take care of the physicians and the providers of mental health. So here is an index to help you access your own burnout. Just what you wanted, to fill out a survey about burnout, but certainly you could do this. And there are several different surveys. And then now I've surveyed myself, now what? You can build your own wellness plan. So there's a button for that as well. So again, another I can partner with my organization, like maybe your health system, to give them some data about provider burnout and say, hey, this is the data. Did you know we're not okay? And then work towards system change. Okay, so now I just want to know whatever else is there. Dr. Shriver, what is there? So here's the additional tab. And so Bright Futures, hopefully you're familiar with Bright Futures, which is the guidelines for how to do a great well child visit. Screening and Technical Assistance Center, that's the STAR Center that I told you about before. There's so much about suicide prevention on here. I know that's a focus for many of us, and certainly an area for quality improvement. How do we prevent suicide? How do we assess for suicide? How do we manage suicidal patients? And then trauma-informed care, so many more resources. And so this is, again, the Mental Health Initiative page that I've been showing you with arrows. And way at the bottom, they have a chapter action kit on mental health. and a mental health education resources resident curriculum. So if you are a residency director or you work with residents and you think they should know more about mental health, the AAP has got you covered. So we're not going to go into depth on either of those, but there they are. And then finally, if you have some cash and you'd like even more resources, you can purchase this practical resource toolkit, second edition, and it costs about $120 if you're an AAP member, and it's all online. So once you buy it, then you can access a whole bunch of different chapters about the policy statements we reviewed, the readying the practice resources we reviewed, some more details about practice workflow, screening, some interventions, some ideas for system-based care, how can you make effective referrals, some more resources for psychopharm, and then additional resources for families. So actually a lot of what's in this book that I bought is available for free, but not all of it. So in summary, and good, I left a lot of time for questions because I went really fast. The U.S. is currently experiencing a child and adolescent mental health emergency, as you know. More resources are needed for providers, patients, families, practices, health systems, AAP chapters, communities, and for our legislative experts to change policy. The AAP website has open access and then a couple just for purchase, resources for everyone. Again, you don't have to be a member to access pretty much everything I just showed you, for promoting good mental health, improving diagnosis, treatment, and crisis care for patients. And then the AAP website can support providers, patients, residents, and chapters with mental health resources. And then finally, in Iowa, and I know not all of you are from Iowa, but iowapeds.org is our AAP's website, and we are currently building some mental health resources. So you heard at the beginning that I am one of the co-chairs for the Iowa AAP Mental Health Committee. And Dr. Michael Coburn from the University of Iowa is the other co-chair. He's also quite busy with other national AAP initiatives. So he's a hard to get a hold of guy, but certainly knows his stuff when it comes to mental health. And so he and I got together to create another mental health toolkit for Iowa's providers. And so look for that on the iowapeds.org website. It's not currently on there, but should be up in a couple of weeks. And he and I are also doing some mental health minutes that should be on our website as well. We only have done one so far, and it's not as long as 14 minutes. So we're going to really try to make them shorter for everyone for time's sake. So that is the summary. If you need to get a hold of me, here's my email. And then if you track me down on Twitter, that's my Twitter handle, or my Instagram handle if you guys are on social media. And that is all. So I'm going to stop now since... and these are my references.